And I have some notes, but yeah,
So I started the recording, so go ahead, Sandy.
very agreeable. Good evening. Today is January 14th. It is 7:05. This is a joint meeting of the Health and Social Services and Community Development and Budget Priorities Committees. Please, everybody who's here, introduce yourselves. I'm
Ryan,
Sandra Unger, Chair of Health.
Ryan Barthel, Chair of Community Development and Budget Priorities.
Pat Cambria on Health and Social Services.
David Levitt, a member of the Community Board and a member of the Health Committee.
Right. Ryan, since we're both here, do you think we should combine our minutes together instead of two separate ones? Pat is taking the minutes and just put down both committees. Is that okay, Jeremy?
Sounds good to me, anyway.
I think it makes sense.
It
Because
makes
if you did separate minutes, they both say exactly the same thing.
Right.
We said the same thing.
Right.
Yeah. All right, I guess I have to read the code of conduct.
Okay.
Okay, Community Board 11 meetings must be held in a professional and hostile-free environment. The following rules of conduct are applicable to members of the public, Community Board 11 and the Community Board 11 staff. Any action or behavior that disrupts or interferes with Community Board 11 business will not be tolerated during any Community Board meeting and may result in the individuals being asked to leave. If the action or behavior continues, this may be considered disturbing the peace, and the appropriate authorities may be summoned. If the meeting is held remotely, the person may be muted or expelled for the remainder. Repeated violations by the same person or group of people may result in further action by the community board. All public speakers must address the full board or the committee with their concerns. Electioneering for a position other than an officer of Community Board 11 is prohibited. Engaging in acts of violence, including threats, are grounds for immediate suspension of the right to attend meetings, pending review by the Ethics and Disciplinary Committee. Respect the equality, diversity, and privacy of all persons by respecting and valuing differences of culture and opinion. Refrain from unpleasant or disparaging remarks and other actions. Abstain from all forms of harassment by actively discouraging it. Disseminating false information is prohibited. Okay, we all did the attendance. There, we don't have any minutes that have to be read. So, Ryan, it's all yours. And then we have questions and discussion.
Yeah. So the reason that we're doing this joint meeting is to try and get input from as many community board members as possible on the budget priorities and district needs process. And hopefully this will be a different way to do it that might get some people excited about it. This document that's attached to the agenda. Let me share it. So for those of you who are online, if you want to follow along, the same place you click to get into the meeting, the next link is the link to that document. And in this document, what I created is the first part for each section are the instructions that whoever is filling this out would see. So I'm going to kind of gloss over. You can read over it at length if you'd like. But basically, this is the instructions for the community district overview. This is the front page that gets sent in to the Office of Management and Budget, gets published on city websites and on our community board website. And what they're really looking for is just to tell a story about this place that we live in, what's changed about it from the past year or the past few years. What does it look like? How is it different from other neighborhoods in the city? And it gives some guidelines. It shouldn't be terribly long, 500 to 1500 words. Try to use research and hard data as much as you can. Talk about what's changing in the district and how that's affecting the district. So this is crafted. Each year it changes a little bit because we get new data. I don't want to go too deeply into this because we're here at Health and Social Services to talk about the Health and Social Services section of this document. But does anyone have any comments? Have you been able to read over this or no?
I read it when I was home.
Mhm.
Now, my question is, so basically you're filling in some of the information that has already been given to you and you're taking it and then working from that. Is that correct? That's
This,
what it seemed like to
this
me.
here is just a blank text box. You fill in whatever you want. So I found, some of these things have been going on for a long time, like the composition of the neighborhood and our zip codes, that doesn't change much or often. But then like this I found interesting, right? We're talking about not having housing, about rent burden, about things like that. Well, we're also not building any houses. Department of City Planning does have a website which tracks it by community board or other different things. Our district is not building much housing. Our rents are going up. There's probably something connecting those. So I found it interesting to put that in there. Another thing that I find very interesting, our population change is greatest in our older adults. And we
Yes.
see a lot of folks in kind of their middle age, young families that are leaving the district, right? You have kids, after you turn 18, the population drops off a cliff until you get back up into this 40s and 50s age.
And higher, yeah,
Yeah, so that affects a lot of things, but it affects
Yes.
the healthcare services that we need, things like that.
Yes,
right.
interesting.
So we can fill in whatever we want in here. This is supposed to be more of a narrative, like I say, telling that story. And then the next section, unless you have more comments on.
No, it's fine. I understand where you're coming from, but yet there are new groups moving in with young children, like you
Yeah.
have Little Yemen,
Mhm,
and you
yeah.
have to address those, and then for the younger generation too, the older and the very young.
Yeah.
Okay.
So then the next section, they ask you, what are the top 3 areas in your district that need addressing the most? And then you've got a bunch of them to select from. I think that we can get them all on one page. Yeah. I kept them the same from what they were last year, because again, it was mostly me doing this. It was our committee who was doing it, but I did a lot of it, and especially filling it out and submitting it. So I didn't want to change anything that had been done in the past without more input. What was there before? It was traffic, parks, and schools, I believe. So those are what we have submitted in the past and what we submitted this year, but I imagine that here we can make a case for perhaps senior services, social services, healthcare services, things like that.
And also, what about one of the biggest things that I remember, and David is probably the only one here besides me who remembers Linda White.
Yes.
And what was her mantra? We need a community center.
Yeah.
We need something for the youth of today.
We
This-
have that. We have Bronx House.
But Bronx House isn't enough. You need something bigger, maybe just a community center for young and old
Especially
combined.
there's older people, like you said.
But
Yeah.
how many
Where to
people
go.
really in this whole
They
district,
don't
from
have
this
one.
whole area, really use Bronx House?
Not
A
a
lot.
lot. No, I mean, yes, for the services that they provide,
Right.
like the camps and the after school and the music program
Yeah,
But as
and the
far as-
swimming pool
and the gym.
and the
yes.
gym.
But as far as like a meeting place for seniors to go to or young kids to go to, like after school, I don't think they have that.
Because do
That's
they,
true, they probably don't.
they don't have like basketball courts
Yeah.
or,
They have
places.
one, but you got to be a member.
Yeah,
Right,
one
right, it's
there
expensive.
in Bronx House.
Yes.
It
They're
is
one.
expensive. You
And they have to pay.
for it,
Open.
right?
You know, I know that they built a new police precinct somewhere. I don't know if it's in Queens or whatever, but in that precinct, they incorporated
Like a youth
Community center type of thing, yeah.
area.
Oh, I
And,
like
Yeah.
that.
and yeah, why can't something,
Especially if they're redoing this 49 precinct, they must have a lot
yeah,
of space there.
Yeah, to redo, and that may be something to bring up.
Yeah.
To do that.
And can I say something?
All right.
I just, you were saying, because it was interesting to, like after 18 years old, it just drops off the population and then it jumps to 55 and up. Which is true because I see that, I've lived in this community, but I taught in City Island, and City Island is this very small.
Yeah, it's like an
community.
enclave.
And it's like really cool. Like I after 30 years, I've retired, but I still go there and I sub. And it's interesting to see that the first graders that I had are now parents. And there's
The kids.
some of them, they moved away, but then they came back and now they're utilizing the school. And now that they put up pre-K 3 and a pre-K 4 program, now I'm seeing even more of the kids that I taught. And like they're coming back. They lived in Manhattan or they lived out of state. Like what is it in District 10 in City Island that's attracting the kids to come back? Is it because their parents' homes? Are they coming back to live in their parents' home? Can they afford to buy the homes? I don't know.
Well, I know
What is
they're
it?
building some houses on City Island. They're building,
I don't know if they're utilizing that, but the thing is, like, it's interesting to, like, what is it that is making that full circle? Like, they left, they got their experience, and they came back. So I wonder if that would happen in our community, because this was once a very tight-knit community, it still is family orientated, but it's not, it's also bigger than City Island, so you don't see that 1 mile, but it's just interesting because I get to see what's in the schools.
yeah, you wonder
You
why.
learn a lot when you see what's going on in the schools,
Yeah, because I know that my neighbor who lives right next door to me bought the house and she lived across the street with her parents and then they moved there. So it was that family.
It was that kind of neighborhood, it was.
Yeah, but now you don't.
No, because
You don't even know who your neighbors are.
Right,
That time.
and everybody's working and it's expensive, they have to pay, to make sure they pay their mortgage, They're
Right.
Go to work, you never see them.
So, but my big concern is the senior center and senior
Mhm.
services and really to help them. And you hear about all these senior scams and whatever.
I
Who
know.
do they go to?
Right, if they don't have
Go
someone
to-
next to
Right.
them, you
To,
know.
for them, and also the youth, because
There's
they're
nothing
the
for-
tomorrow.
Yeah, and there's nothing for them, and that's why they're getting in trouble. There really isn't anything
Right.
for them.
And also one of the things I brought
Not
up.
without paying a few $100.
Right, unless you pay, like,
Right,
listen,
so
my
yeah,
kids,
fine.
my son played ice hockey, my daughter's figure skated. They were never around, but that was money, that cost money. But you know what, I knew where they were, that's the thing.
Right.
If you're not willing to pay for these programs, basketball or whatever, you're in trouble.
The other big question is, last year I had someone from the blood bank come.
Yeah.
And they were looking to have a blood bank in the Bronx, here in this area, because there is no blood center in the Bronx. And then there was talk from the borough president, oh, we're looking and we're looking.
Yeah.
Well, I guess they're still looking because.
Yeah, we haven't heard
You
anything.
heard?
Well, Monty has one, but they don't do it here. They do it over at the main hospital.
On Gun Hill Road?
They have a blood center that's from the blood bank.
I don't think so, but I think it's run by Monty and that's a while ago. But there are also blood drives. I mean, I've seen,
Yeah,
Yeah, but
there's
but
tons of
this
blood
was
drives.
a whole blood. When she came, and I'm gonna ask her to come back again about a blood center, which is, a base.
Yeah,
Where people can go in, because we have people on the community board who go up once a month to Elmsford or somewhere to donate blood
Yeah.
platelets, this,
right, from Westchester Medical Center.
wherever they go.
Yeah,
And we have none here, right in the Bronx. If
We
you
should
want,
have
there was
one.
in- there in Manhattan, years ago,
I
they had
know.
one.
Yeah.
And that's another,
and there's like so much like I said, there is so much property on buildings that they're going to construct, like on the corner of Tenbrook Avenue. That building is supposedly going to become a community center, I think, but an Albanian community center. That's what I'm thinking, that
which one?
on the corner of Tenbrook Avenue and Morris Park, right across the street from there's a liquor store.
I don't know.
It's been abandoned. It was owned by I think it was owned by it was private. They used to do imaging there years and years ago.
Hey, look, they have the Pelham Public, the Jewish Center on Esplanade that has been.
Right, it's been vacant. Why don't they use that? It's
Because,
just
it-
like
That's the one that I was thinking about, yeah.
Yeah,
you know, that, because, I mean, it's huge. They
they don't have
had-
any services there at all?
No,
It's closed.
The-
Borders
it's
is
been
Wow.
closed for years because the older group that was there, and there was a younger group, which I was a part of at one point, they didn't, they were dead set. They had a mindset. They really didn't, trust the younger people. If David, you're laughing, but it's true. And they decided to sell the synagogue as the
Yeah,
patronage became less and less, and they were made promises, but it's still considered,
It's owned privately. It's not a synagogue anymore.
it's nothing, it's still boarded up.
I think there were a lot of problems with that building related to the subway underneath.
well, how about?
Well, that is
St.
part of it, I
Francis
think,
closed.
but the
That's
Lubavitch was looking to
abandoned.
sell it privately.
Where's that one?
They can't.
Right here, right where the park is.
The
right
religious,
behind, Loretta Park.
thing,
Okay.
That school
it's still,
closed.
was under
And then
religious
There used to be
so
not
whatever
a synagogue, but a Jewish center.
designation.
Oh, well,
on-
that just taxed.
It was a whole
Yeah,
building
but-
around the
Hi,
corner. was-
guys, there's a lot of crosstalk and I'm on remote and it's hard to follow the
And
conversation. I'm
We're
sorry.
talking about the
Mhm.
synagogue on Pelham Parkway and Esplanade, which it's been vacant for years and years and boarded up, and there's been a lot of that would make a wonderful youth and senior center. And what would be nice is you have both of those groups together and they would be good for one another.
It's
If
gotta
you
be
think about it.
easy to access the people. So
Oh,
that they
it's
can-
in the subway.
Do
it's
you know
the-
who owns the property?
What?
Do
They
you
figured
know
that
who owns
out.
the property?
Yeah,
I know it now, though.
Yeah, but I mean, why? Why is it still vacant? I know that it had the religious designation, but can't they take it off? Yes, it's, the subway is a big thing underneath. That's why they, that's why the eye clinic for almost a year,
yeah.
they had to work around it because the imaging would move when
Oh,
the
yeah,
subway
that's not
battled.
good. Yeah,
Yeah,
that's probably.
but
why.
I mean, to make a center, you're not having this, medical equipment.
No,
So it's something to think about.
Yeah, and that is mentioned somewhere in here. I don't recall where exactly. We should be publishing the full document, right? This is just
An overview.
well, this is, so we got the first part that we're going over now, the narrative and our top 3 issues, and then we've got the health and I've got our committee name. Anyway, we'll get there. We've got the health section that comes down below, but there's sections related to all of our committees. And we've got the full document, and Jeremy said that they're going to be working on putting that up on the website, the entire thing. But we'll come on back. So these aren't, if you have any comments on them, traffic is one of the issues. Schools and lack of seats or seats that we've been promised and haven't gotten.
Oh, wait a minute. You're talking about school seats? The school, when you think,
It's, like, I tried not to inject too much of my own.
no, that's okay.
into this.
Yeah.
But yeah, this is something that I've heard talked about quite a bit over the past few years. Yeah.
especially with the new buildings that were built.
They built up 97.
And 108 as well.
But 97 had, I heard, but I don't know for sure, that the old building is not even utilized. You could make that school a K through 8. And it would be wonderful.
It is not a K through 8.
No, I think it's still K through 5. I don't know. It's we have to, I guess, the,
Because 108, they just made K through
That-
8, but it's phasing in. So now they ended at 5th grade. Now they have a 6th grade. Next year they'll have a 6th and 7th, and then following year.
yeah, but
6th
you have a whole building.
Yeah.
Yes, it's an older building, but use it. What is
Yeah.
it used for?
So
And that would easily help.
yeah. So I'm not sure when we speak with the education committee, they can probably give, I mean, I'm sure we got some on the community education council in there, some people who can provide a little bit more knowledge because
Yeah.
I don't have it, but. And then Parks and Open Space was the other one that was, again, holdover. I didn't want to change these around without without the input. So that's our district need and top or district statement and top 3 issue areas. But now we'll get down into the policy area, healthcare and human services. And this again, the instructions that we get, it tells us the type of agencies that we're thinking about. I don't actually know who DFTA is.
I don't either.
And then health and
Well,
mental
it's
health.
Department for the Aging.
Ah, okay.
What is it?
For the aging.
Department of Aging,
Okay.
Department for the Aging,
Okay.
Children Health Services, Health and Human Services, yeah.
And then they talk about the specific kind of issues that we might be thinking about. So public health, seniors, low-income New Yorkers, people who aren't able to care for themselves, victims of domestic violence, people looking for jobs, so they're putting that in there as well. So again, the human services area of it.
Well, you could also put in with the Human Services, senior housing or senior living.
I
In-
believe that's
But
specific.
low
There is a
income, but
housing
There is.
area as well.
Okay.
Yeah.
So,
But,
okay,
I mean, that is a part of
yeah,
seniors' health. If a senior is not
Right.
living in a healthy environment, that's, I mean, it certainly
Right.
matters. And then mental health, substance needs, and people with homelessness. And then it tells us, in here, we're going to talk about the single most important issue, as well as it's going to talk about a few specific policy areas. And then it gives some resources that you can go to both learn about what is available through the city and learn about what we're going to put in and to try and learn about the healthcare options that we have already. And these are listed by department. All right. And then for the most important issue, again, instructions. Tell us what the most important thing is. And what I chose, again, what I said, and this is where I'm really looking for your all's input. Since our seniors are our fastest growing demographic and our largest demographic, we need more services, facilities, programs for seniors. And then also we've got seniors are going to have a high burden of NCDs, non-communicable diseases, and we need to be able to address all of those types of things. So I'd like to hear your thoughts on this particular response, and it's kind of small. So what else we can add to it, what else we can talk about? If this is an appropriate response or something else is the most important.
I'm laughing at the cooling centers because at one point when the hot summer, I just wanted to see where the cooling centers were, but they were not within easy reach for anyone to get to.
Got to walk outside for
Yeah.
20 minutes.
Why there were no services to take them.
Yeah.
It wasn't at say at 97 where a lot of people
Right.
could gather.
Mm.
It wasn't. So how could they get there
Yeah.
without having heat stroke?
Yeah, no, that's really true because you got to be able to
Yeah,
get
so-
a cooling
so you
for
have
it to be useful.
Do it, like some places or in some areas of the country, they have like little jitneys or whatever that pick up
Right.
Yeah.
people. And
I think that's.
You know,
fine.
We have a public transportation service.
Right.
yeah, but
We don't have
they
to
would come-
have, but it's.
you know what I mean?
that's
They would come to your
important.
door
Yeah.
literally.
Yeah,
I think about my, the older people where, when they can't drive anymore, but then their whole quality of life is taken away
Yes.
from them because they're used to going to the store, going to spend time. Isn't there something that's available that we can provide for them?
yeah,
mean-
to get onto Access-a-Ride is not.
It's not easy
It's
unless you
one
have
of the-
Medicaid or whatever or you're a certain budget. If
You
you're
don't
none
get
of it, you don't get it. Like, I'm thinking of family members, like my aunt who's been very independent and she hates relying on us, but we don't mind. But like, she can't get it because she
Yeah.
doesn't fall into that category and it's not fair,
Yeah,
Someone who lives in
Right,
Southern Morris Park or something like
Yes.
that, you're a long way
Yes.
from any buses.
Yes. it's true.
It's hard.
yeah.
That's my.
No, that's a big need. How do you get the people to where you want to have them get help?
Yeah.
And they can't do it
Right.
themselves. And maybe they can't afford to take a,
Take a taxi.
an Uber or a
Yeah.
taxi or whatever.
Spend $20 a day to go to and from the library. or
Yeah.
whatever. Yeah, I mean, it would rack up real quick.
Yeah,
Right. So that's a big one.
Yeah.
And also, if you could do something with the youth where they know they can go for free, not to pay, but they have the services there to hang out literally.
Yeah.
Yeah, like Westchester does in the summer with their buses. The buses are free in the summer. It gives the kids something to get on and you can go somewhere.
Well, now, do you know that in New York City schools, because my granddaughter,
Yeah.
she has a bus pass
Mhm.
for 24/7, 365 days a
Yes,
year.
like, yep,
4 rides a day.
yeah.
4 rides a
Which is
day,
nice.
every,
Nice.
including weekends.
Yeah.
Oh, you know you.
I know,
said,
when I was a kid, Jacoby Hospital had a gymnasium. It was like really cool. You would go, they had the pool. There was like places for us to do things.
And that's closed now, they,
Oh, yeah, the pool's been closed for over 30, 40. No, I'm 60 more. Like,
okay.
but it's like that, we were able to do that. That was our meeting place, you know? But that's gone.
Yeah. So.
Could I
that's what-
share?
Yeah,
Who is
yeah,
that?
I'm sorry.
Is
Oh,
that
hi,
Matt?
I'm Madeline.
Hi,
I'm the
Madeline.
fellow. And yeah, so I think I completely agree that senior issues is really important. It's for my
Yeah.
job. I work for New York Connects. So every day I speak to seniors who are struggling with these issues of social isolation, difficulty getting services. And I think it would be, I think maybe really useful to think about how how resources for seniors can be communicated, because many seniors utilize technology very effectively, but many also don't.
Right.
Yeah, and I think that the problem is that everyone else, or most young people, are connecting virtually and they're not connecting in their community. But that's not what older adults want to do, or and that's not what we should be doing.
No, they want
Right.
they want live people in front of them.
Well, do you know that most
course.
groups now make the assumption
Mm-hmm.
that every older adult has a computer or an iPhone or an
Yeah.
iPad,
No.
and that they know how to use it.
Mhm.
So now they're telling you, well, if you want, like say with Optimum, go online and look this up because we no longer have MSG
Yeah.
on
Right.
Optimum.
Yeah.
So, and if they don't know what to do or they
I
don't
know.
have the means, how do they do it?
It's not right. And
It's not fair to make that assumption,
No,
but they do.
Yeah.
Every.
but that's the corporate world. That's what
Yeah,
even
I
you-
agree.
even Our
it
union,
is. It's the
Pat.
corporate-
But
I know.
could I share? Sorry. So where I work is a place for seniors to call in. So there is a provider for the Bronx, which is Neighborhood Shop, but I find that people really respond well to speaking to a real person
Yes.
over the phone and are seeking that. And I speak to people every day who've been calling for days or months or however long, right? And yeah, I think it's about connecting people to people. But the problem is that
How do you
most of these social services providers are too busy because they don't have people dedicated to communication.
Well, you know why it's also too costly. And
Of
many
course, yeah.
companies are in it to make money.
Mm-hmm.
That's why I say, like America, I always say that America is not for old people. It's not.
I agree.
In Europe,
But
it's like a different story.
what if the board could serve as that purpose, right? Because we are all of the board members are so dedicated and give so much of their time and energy. What if what people are needing is human capital, advocacy.
Right.
So what
Right.
if the board could serve as a way to connect people?
How would we do it?
I
Mm,
Madeline.
yeah,
This is Stacy, the
Who's
Hi.
talking?
co-chair of
Sis?
budget.
Lucianne.
I have an idea. I don't know if it might work, but what about like lobbying with elected official and senior centers to see if they could allocate, at least for their next budget, some money to get like a shuttle bus to shuttle seniors to like different centers? I don't know. Just an idea.
Yeah, I think that would be super
Does
useful.
Rain have a car or a van that could pick up?
Excuse me, I'm sorry to bother you guys. It's Kay Cardona. I'm a
Like a-
member of Bronx House Senior Center. I did a lot of things there with my son when he was young. The senior center does have shuttle buses, and they do pick up the seniors
Oh,
from,
nice.
I guess, their homes or whatever block, if there's a few seniors from that particular area, and it also drops them. Not that many of the seniors use them because some of our seniors come from other neighborhoods to use Bronx House because of the particular programs that they have for seniors. So you could reach out to them. I'm supposedly the community advocate for the older adult center, but they don't really utilize me. I just go out on my own and do whatever. You know,
Okay.
connect. Yes,
All right, Jay,
Hey, okay,
let me ask you a question.
Sure.
As far as who can apply for this? I mean, do you have to be part of the Bronx House for this
Yeah,
or?
you have to be part of the senior center. So once you're 60 or older,
Yeah.
you see the social workers there in the older adult center, and you sign up, or your loved one or whatever,
Mhm.
and they can be a part of the senior center. They do lunch every day, they do trips, they have all kinds of things. And as far as computer, Rain, I know has computer classes as I used to go to Rain. Bronx House also has computer instruction. They have all kinds of things. And there is the youth component there too. Like I said, Bronx House, it used to be called Latchkey, the after school program.
Yeah.
So they are actually a community center. The problem is if you look from Williamsbridge down to White Plains Road, if you go by Van Ness and you go Pelham South, Pelham North, going into Allerton, if you look, it's mostly buildings. And most of the people in those buildings, even if it's two people working and they have decent incomes, if you have kids and other expenses, a vehicle, or you're paying for your apartment, it's a co-op, whatever, it leaves parents with not a lot of money to think about after school or, hockey or whatever it is they want to do. So any kind of community center that you want to introduce into this community, and this is something I've been working on since 2008 with Mrs. Dawson, right? I don't know if anybody remembers Nancy
get to the
Dawson.
point, Kay, please, because we have another meeting that's
Okay.
gonna start.
All right, so point is, we went to DYCD in 2008, and they said that we weren't like below the income level for them to help us.
Right.
So if you want to do a community center, it has to be like income based because there's a lot of struggling families. And as you know, the rent keeps going up and up, everything just goes up. So if you want to reach out to the city electeds, whatever, in terms of a community center, it has to be based on income, like a sliding scale. The other thing I want to mention is I'm a former board member of Easy Living Shelter. Okay, Naquan Hallback, who is on the 49th Clergy Council and a minister. We have been trying to get a shelter and a community center for years. You might want to reach out to him too, in terms of like grant writing and stuff like that. So, I mean, that's just a couple of ideas I wanted to bounce forward. I'm sorry I didn't wait for the gallery section.
Thank you.
Getting what you
I,
need.
can I
Yes, bring this in for a land.
Yeah, so it's we're gonna try and get through the rest of the sections because we are pretty close to the end of or to the start of the next meeting. And if there's any other gallery comments, we'll do those after we have finished the rest of the agenda. Cynthia, you had something?
No, just quickly, I did speak to Mr. Hallback from Easy Living, and I'm gonna put him in contact with Sandy.
Okay.
Okay, so to your question, David, it's less about what I need and more about what you all would like to be represented here. So, I mean, I'm taking some notes, going to add some more to it, but we got until October 31st before the next one's due. So, whatever sort of comes to your all's mind, whatever comes up over the next year, please do send it to me.
All right.
So after that, so this was the top issue, and then they give a couple of different sections. So the needs and Health and Human Services has the most of them out of any policy area. But they ask, what do we need for healthcare and facilities? What do we need for for New Yorkers specifically? What do we need for the homeless, low-income New Yorkers? Yeah, that was it. So this is what I was able to add in for this year for our health facilities. Our healthcare facilities are not evenly spread throughout the district. We do have hospitals. We have Jacoby, we have Monty over there. But they're largely concentrated there, and we don't have nearly as many over where I live on the west side, on the northern side of the district. And when this is combined with mobility issues or with folks who can't get around by themselves anymore, it makes it very challenging for some people to get adequate medical care. For older New Yorkers, obviously talked about that in the most important one, but we're seeing the greatest increase in population. And we need, because these folks need more health care generally, we need more health facilities to serve them, and they need to be accessible to these folks.
Yeah.
And we also need dedicated hospital staff. We have the folks from Jacoby have come in and spoken a few times about being asked to work with populations that they're just not trained to work with.
I
Right.
like the thing with the stroke,
I've heard you mention that a couple of times.
ambulance, because if they know the stroke protocols and they can administer certain meds right away, it
Yeah.
could save a life and
they
make
could.
a complete difference
Yeah.
in recovery.
Yeah, we call it the FAST protocol to recognize that for a reason. You get it faster, you have better outcomes. Yeah.
And Ryan, I see that the needs for low-income New Yorkers, there is a great need for that. But in the whole picture, if we're talking about this district, especially this area, there are low-income seniors, but there's also middle-income seniors, and that's the ones that are suffering. The middle income, they
They
can't,
get
they
nothing.
get nothing, and
Right.
they're
Yeah.
not getting like not even an access right like we talked about. So we have to figure out something for these people because the middle that's the ones that are suffering now. There is a lot that's coming in for low income, but not as much for the other group of people, which is
Yeah.
sad. And
Yeah.
that's what's here, you know?
So yeah, I'll add that in. That's something that talk about a little bit in housing. Folks talk all the time about. We talk about affordable housing, but what does affordable mean? If it's not
Right.
if it's affordable based on the entire New York metro area,
Yeah.
which is how they define it, it's not affordable.
It
for
is
very
not
many people
affordable.
who live here. So
Right.
what does low income mean? Who really needs?
Yeah, it's not clear.
Right, they go by the median income, but what
Yeah.
is the real median income? Before I forget, under new business, I want to do this. There is going to be a community advisory board. Oh, boy. All right. There is going to be a community advisory board for the homeless shelter on Blondale Avenue. And they are looking for people in our community who may want to question, give information, gather information. And if they are interested in being a stakeholder, they can call the board office and register. So please, because whatever it is, that meeting will be held in February. And I wanted to get that
Yeah,
across. So it's the Blondell CAB formulation meeting.
Really.
They haven't given a date in February, but they need to know who's interested. Right?
I think Kay Cardona was interested in that. So Kay, if you can reach out to Jeremy and give him your info.
I
Sure,
don't know if
Cynthia.
she's still on.
Oh, yeah, she is.
Okay,
Sure. I'll gladly do that. Thank you.
you're welcome.
Right.
Right.
Did you have anything else to add for the needs for the homeless? Any other thoughts on that?
I'm fine for now with that,
Yeah.
because that'll be a big one. It's gonna be, I think, a 200 bed shelter.
Yeah.
Wow.
That was it.
Okay.
Are there any other questions?
The other part of, so the district need statement is more narrative. It's more talking about what we have, the challenges that we have, and telling about our district. The other part is our budget requests. So I think everyone is.
And do we give a monetary figure or is
No,
it
we're,
just?
they don't want to know what we think it'll
We just
cost.
make a request.
You just tell them this is something that
We
we
don't-
think that our district should need, yeah, that our district could use.
So maybe we can invite you back or have another joint meeting. so
Yeah,
that we're not rushing, this part of the discussion.
yeah, maybe sometime in June or in, yeah.
So the challenge with that is we're gonna be trying to do this with all of the communities, or all of the communities, all of the committees, all of the different policy areas. And even as it I think there are 8 different policy areas in there. I have to go back and check, but so January, February, March, April. May.
We were the trial run.
Yeah, really.
I think we did
So
rather
we're
well.
gonna be struggling to get to all of them.
I
now,
hear what you're saying.
But absolutely, if you come up with anything, if you have any thoughts on the ones that are already included, or if you have other thoughts,
I think
whether
we
it's in the policy area or not, I just pulled out the ones that were health and human services, but
I think this gives us a good start, and I think, Sandy, we should put this on the agenda. We shouldn't wait till June. I think we should have it on the next meeting agenda,
Well,
or at least this month after that, to discuss this more in detail.
all right,
That we're not doing things at the last minute, and we're also setting example for the other committees.
well, it's good that you bring that up because Madeline, who's working on this survey and study that she's doing, who deals with seniors and whatever, will come to our meeting next month.
That's
She's
nice.
gonna lead it to
Okay.
bring us in, and so it's literally almost an extension because she'll talk more about what she's doing and what we can do to help. So, yeah, so,
Is there anything about mental health?
Yeah,
excuse me,
there's a, let's see.
there
it's
was.
falling.
No, it was.
We may be running over, but
There was something.
I thought I saw it.
what it,
Mental
Mental
health.
health, but not mental health. No, we didn't. There's something maybe in the youth section. I'm struggling to remember. But these are so all of the budget requests that came from, sorry. Oh, I thought there was another. They came from, let's see, the bottom 2 came from a community member and the top 1 came from a board member. But yeah, we didn't get very many budget requests this
Right.
year. So,
What
but if you
get-
have any thoughts or if you have anything, something that we can specifically say, this is something that we need and we can add in, yeah.
like,
But I'm from a clinical perspective, I know mental health is a big
louder, so
problem.
that they.
Yeah.
Oh, just from a clinical perspective, I know that mental health is a big area of opportunity in the Bronx.
Yeah,
Especially, and because I work in the South Bronx, and I know that the mental health crisis is getting worse. I mean, obviously the opioids and obviously, like a lot of depression, anxiety, mental health issues are getting from bad to worse. I just think that if you're gonna be thinking about health and wellness, I think mental health should definitely be folded into that.
Well, I do know that they're supposedly creating a health and wellness center on the old grounds of Bronx Psychiatric, because now it's the developmental center. So they're working on that. But we have to remember, the state closed a lot of the big facilities. And now it's like a revolving door. You're in and you gotta be out within X amount of days, so to speak. And that's not, it doesn't always work.
It's because like they're running a business, really. Oh, no, thank you.
Did you have any thoughts on like something specific or you want to take it back and talk
I'm
about?
gonna take it back.
It's all right, it's all right, it's all right, Pat.
It's mental health
The
definitely seems something
opinion
else.
needs to-
that's Chiara's recipe, the pinoles.
Gee, I did the one from the TV.
Yes, I use her recipe. And these are good too, these tasty.
All right.
The what?
I'm
Right, I'm going
sorry.
to close this meeting and I thought it was, you got something else? Well,
We should probably let's see, who do we have on here? We have Ms. Reed Dupont and Diana Finch. I don't know who CT
Do
is.
they
We
have
got
any-
a couple.
Do they have any questions?
The gallery who'd like to speak quickly, who hasn't spoken thus far? In person?
Waiting for.
And I will be able to get this online, right?
Yes, it
Yeah.
is attached to the agenda.
Okay.
Yeah.
I have one quick question. On the budget
Is it?
request,
Diana.
So Diana, for-
Yes,
yeah, on the budget request, are we supposed to have a dollar amount in mind? Like,
No.
is
we
there,
don't
a
give a
no,
dollar
no,
amount.
I'm not asking, are we supposed to say what it is? But are there requests that are just way too expensive to put in? Because these requests all go to the different agencies, is that right?
correct.
And then the agencies will say whether they can fund them or not?
Right. So, I mean, ones that are ridiculously expensive, trying to think of what an
Like, there's a
example.
community center, for example, would cost tens of millions of dollars. And we'd need funding from multiple electeds and
so-
Okay.
Yeah.
You
No, I mean, it's still something that we
versus
can-
trash cans for the parks.
Yeah.
Okay. Came
Um,
this in front of me.
There is no guidance on a dollar amount
Okay.
or on, I actually asked this question the other day. No guidance on a dollar amount, no guidance on where it is. So we can ask for things that are not in our district, or we can ask for things for other districts. The
Okay.
budget request section is very specifically open-ended.
Okay, thanks.
Yep. Anyone else?
Okay, so for the record, FY 25th submission was done without full board vote, much less notification to the public what was submitted to city planning.
Thank you.
So I would think, to be fair, this committee, the budget committee should send notification to city planning that this was not done with the full board approval, much less notification to me what was submitted. It was done like just a few people behind closed doors. And that's not right. And I think you saw the Bronx Borough President saying that no committee should be doing things without full board vote approval. That's not how community boards should run. So would that request be honored?
That it be sent to, that we send something to.
The city planner
city
notified
planning?
that the full board did not vote on these submissions.
No,
Why not? If they did not.
correct.
But you-
Well, actually, the full board did vote on
They
it,
did
yeah.
not.
Are you finished?
No, but they did not vote on it.
Correct.
So you refuse to notify the city planner that they did not vote on it.
Correct.
Okay.
We
I
have
think
to get to the next meeting.
The process
will.
last year was a little rushed for understandable, unavoidable reasons. And I think if people keep showing up to the committee
Diana, can
meetings
we
and
please-
discussing
Diana,
things that,
Then she's allowed to violate code.
that it will be fine, Roxanne.
Yeah.
Violated, so
You can all participate.
All right, point
the
of order,
meetings.
people, please, please. Roxanne, your objection is noted. I do take issue with the contention that it was done behind closed doors because Ryan spoke at pretty much every board meeting about the issue. Let's move on. We have another meeting.